welcome to our special series, Medikabazaar presents Transforming Healthcare, wherein experts from across the healthcare industry share their insights on changing trends of the industry that are leading to a brighter and more technologically advanced medical industry across India. In this episode, we spoke to key leaders from the medical equipment and devices field for their take on the issues, challenges, and possible future solutions for a sector that is growing exponentially.
The medical device industry manufactures equipment designed to diagnose and treat patients within global healthcare systems, ranging from simple products like nebulizers and hearing aids to complex programmable pacemakers and sophisticated imaging systems. Some of the most common medical devices include infusion pumps, MRI machines, CT scanners, X-ray machines, LASIK surgical machines, and many more. With the changing economic and regulatory environment, the growth of the medical equipment and devices industry is fueled by a range of factors that includes the growing presence of corporate hospital chains, international companies, and service providers entering Tier 2 and Tier 3 cities, rising prevalence of chronic diseases, aging population, etc. However, there is a huge gap in the current demand and supply of medical devices in India.
Indian healthcare industry is recognized all over the world as one of the mature healthcare delivery programs and a mature healthcare delivery industry. As you are aware, Indian doctors have created a brand for themselves in US and Europe. Over 30,000 doctors, Indian doctors, serve the National Health Service of England, and a large number of doctors serve United States healthcare needs. Coming back to India, we do have great challenges, mainly because of the vastness of the country with 1.3 billion people. So on the whole, there are many issues in the healthcare industry. Of course, apart from the shortage of skilled manpower and the ability of the patients to pay, the biggest problem we face is bulk of the hospitals where quality healthcare is offered in secondary, tertiary level healthcare. And Tier 2, Tier 3 cities have very few hospitals, mainly because they're not able to attract talented people, and also getting material to those hospitals itself, like during COVID time. Supplying oxygen was a great challenge. So we have quite a few problems, but on the whole, things are much, much better today than it was before.
The Indian equipment industry right now, it's about 11 billion, but it is really $11 billion, but it is growing at a phenomenal rate. And I think there's all kinds of estimates of 30 to 50 billion in 3-4 years. As we see it, there are a few factors that are really driving this growth. The first is, the population, which is aging, and there's increased life expectancy. So many more people are living to that point where they need technology to support them in their quality of life. Secondly, with COVID, what we are seeing is that there's a significant increase in awareness of managing health and looking after yourselves. So we're seeing a lot more people who otherwise might have just postponed coming to the doctor are now starting to come to the doctor with all kinds of things, and we really expect that to continue growing. The third is very big investments in infrastructure. I mean, the government themselves are committing large number of funds for investment in hospitals and healthcare in Tier 2, Tier 3 towns, and the private sector companies are also doing the same. So definitely, as the infrastructure increases, diagnosis will increase, and we expect a big growth.
The first thing that is driving in India from a medical technologies perspective is the great health-seeking population in the country. Second is 360-degree awareness among the providers, the healthcare professionals, and the patients. Third is the government's initiative on health reimbursement that is also eliminating affordability concerns across the population. Next is the providers in India. They are always willing to offer the best and the latest to their patients in order to improve the safety and efficacy of the procedures. The fifth that I feel is an important driver here is primarily the Indian medtech space. The health infrastructure is gearing up for making India a medical tourism hub. So from a global perspective, India is a very attractive market, and over the last decade, there is a huge transformation that has happened on the medtech space in India. Among all the large global economies, India is the fastest growing medtech market. First let us understand what needs to be done to overcome some of the challenges more at a macro level. The number one, the government health programs. We need to create an ecosystem where more and more private sector can participate in the government health financing program. That will create investments in the smaller towns on the health infrastructure. So there will be greater adoption of medical technology in the tier 2, tier 3. So we will see less of urban bias. Second thing is, India is a great place for research and innovation. There has to be a boost in the R&D in India. Third thing, harness the power of the global supply chain.
India is the fourth largest market for medical devices in Asia and has 750 to 800 domestic medical devices manufacturers in the country. According to IBEF, the market size is expected to grow at a 37% CAGR to reach $50 billion in 2025 from just $10.36 billion in 2020. The Government of India has commenced various initiatives to strengthen the medical devices sector, with emphasis on research and development and 100% FDI for medical devices to boost the market. According to IBEF, the medical devices export market stood at $2.51 billion in 2019-2020 and is expected to rise to $10 billion by 2025. Also, India's import dependency on medical devices accounts for 75 to 80%, especially on sophisticated device segments like surgical equipment, patient aids, and implants. And according to Fortune Business Insights, the global medical devices market is projected to grow from $495.46 billion in 2022 to $718.92 billion by 2029 at a CAGR of 5.5%.
When you look at Indian healthcare market vis-a-vis the world healthcare market, India is a very small part of that, but on another part of it, it's growing very fast. And the pandemic last 2 years, the COVID waves has really shown up what is the Indian infrastructure is. If you see, in 2020, we used to spend just 1.8% of our GDP on a healthcare, but the target for the 2025 is 2.5% GDP. So that's a big thing. And as you know, the technology is changing at a very fast pace. Now you see, you sitting at home, you can have your consultation, which was not thought about that thing. So that is what is going to change the world. Now everybody has a mobile, and your mobile is going to take care of everything.
What is healthcare? When we have to define the healthcare, it is hinging on the 4 pillars. And the first pillar is adequate strength of clinicians and paramedical staff. Second is the right size of infrastructure. The third is pharma. And the last pillar, which is where we are in medical devices, and this is again a very, very important. But what I want to actually say here is that today, of course, when we meet health ministers and Secretary DOP and all of them, they all say that this is a sunshine sector. But the primary challenge is what I feel is that currently whatever is being manufactured in India is a low-end technology product or mostly a consumables. You don't still have a high-end technology products being made here. And the reason is that those technologies are not available, and you have to build those technologies through R&D. Another challenge which I see where why medical device industry in India has not really grown is that the custom duty or import duty is very low. In my view, med device products should see higher duty because that's the right approach. And if raising duty is not a solution, then probably a PLI, what we give today of 5%, should go to 10-12%. So I think these are the areas, and that is where the solution I see can make it better.
Our greatest challenge in equipments, Medtech, is that we are not indigenously producing these products. This is our greatest handicap. We have to depend on the overseas market for either the whole equipment or the part of it. I wish we made investment in that area many, many years ago, but COVID has dramatically opened the eyes of all the policymakers and all the leaders of healthcare industry that when we desperately needed the ventilator, no country was willing to sell the ventilators. Everyone became very, very conservative in protecting their own interests, which is fair. But a country of 1.3 billion people cannot really depend on the overseas market to supply vital products to save our lives. So things are now different. Government is looking at all these vital products to be made in India. You must realize that global healthcare and wellness industry is over $11 trillion industry. It is a massive industry. So it's high time we invest on those areas. And when the product comes, healthcare leaders have to embrace these Indian products and start using it.
On that note, it's time for a short break. But our special feature series, Medikabazaar presents Transforming Healthcare, continues on the other side. Stay tuned. Welcome back. You're watching our special series Transforming Healthcare, presented by Medikabazaar. We're in conversation with game changers from the medical equipment and devices industry who are sharing their inputs on how the industry is growing and addressing existing challenges.
The healthcare industry is witnessing the emergence of new formats like chains of multi-speciality outpatient clinics, mother and child care hospitals, IVF centers and more, which are driving demand for medical devices. At this critical juncture, the Indian government has identified medical devices as a priority sector for the flagship Make in India program and is committed to strengthening the manufacturing ecosystem.
What is Make in India? Make in India is a philosophical approach backed by national strategy. What is that national strategy? Understanding behind Make in India is that a sufficient percentage of local value addition is done, which allows it to be declared as Make in India, as made in India. And to achieve that local value addition, we provide certain incentives. What are those incentives? Those incentives are production linked incentive, which means the more you produce, the more incentive you get. The second incentive is the preferential market access policy for made in India products. The third incentive is provision of scientific laboratories and industrial infrastructure to make manufacturing of medical equipment possible. Now, if you put all this together, the incentives given to promote Make in India, to promote manufacturing of indigenous medical devices, are either scientific incentive or commercial incentives. Now, scientific incentives and commercial incentives, when they are put together and provided the right ecosystem approach, the skill building, the certification of human resources that work in medical technology, and platforms like Medikabazaar, which is market access gateway for selling of made in India products. That package is what is going to take country forward in indigenous medical devices production.
Service for medical equipment is one of the most important things that our companies like Stryker, like all medical equipment companies, focus very heavily on. Because, it's fine to sell something, but we need to make sure the equipment is working, it's functioning. And the demand from our customers of having, up to 98% uptime means that the equipment should never be down because they can't afford the equipment to be malfunctioning or non-functioning. So this on-demand service is very, very important, and I can just see it increase over time. Many companies are significantly increasing their investment in making sure there are feet on street or people who can service the equipment at the hospital, and if they have to bring it back into their own service centers, to turn it around very quickly. So service is going to be huge.
First, let me explain the 4 stages of the life cycle of equipment, high-end equipment. First is planning. Second is acquiring, third is operating, fourth is disposing. Now, out of these 4 stages, the longest and the most important phase is the operating phase. One of the concern hospitals or providers always had while acquiring a medical technology is the service capability and the spares availability. Now, today when you have large players in this market, they have their own setup, but India is a vast country. Plus, when we are trying to talk about harnessing the power of global supply chain, there may be a lot of smaller players across the globe who might not have introduced the technology in India because the service infrastructure is not ready. So, if we have a marketplace for services and spares management, I think that will greatly boost competition, and we will see greater innovations coming into the country, especially on the high-end side.
We've heard about the key challenges and the emerging technology trends and solutions in the equipment and devices industry from key opinion leaders from across the sector. Now let's hear from Mr. Vivek Tiwari, founder and CEO of Medikabazaar, on how Medikabazaar is transforming the equipment and devices industry with modern technological implementation.
Medikabazaar is India's pioneering and largest online B2B platform for medical supplies. The company has been growing at an exponential rate and is now clearly the most prominent digital platform in India in medical procurement and supply chain. Medikabazaar's catalogue ranges from high-end medical equipment to specialty medical supplies, including pharma, non-pharma and dental.
If you see the overall medical devices industry, it's grown phenomenally well over last 5 years. The industry size is close to $10–11 billion now, and it is going to be a $50 billion industry over by 2025. I think the growth, the CAGR is going to be upward of 35–40%. In this high growth industry or high growth sector, we need to be really mindful of what kind of medical technologies are we bringing out for the patients. So what we have understood with our experience in Medikabazaar, that all these medical technologies which are kind of at the innovation stage need a very strong go-to-market kind of platform or go-to-market element for them to see the real kind of a market opportunity for them. That's where Medikabazaar as a platform really helps these medical technologies to see the real opportunity with the patient care, with the providers network and all of that. Coming back to Vizi and VPO as the solution, Vizi is our patented solution for intelligent inventory management. This solution really helps our customers, especially the hospitals and medical centers, to maintain lean and best cycle of inventory across different continuum of care specialities they are looking at. BPO, as we normally call it, as a value procurement optimizer, is really the value for every rupee which is being spent in the procurement space today. We started VPO model in 2019 with one very large hospital based in Bengaluru, and now we are successfully running around 40 VPOs throughout the country, and the projection is to take it to more than 100 large customers over next 1–1.5 years. I think this will become the massive game changer in the way medical procurement is done today.
Medikabazaar has got dedicated teams when it comes to hospital infrastructure. Medikabazaar teams are exposed in Indian and global markets, which can bring best practices of developing, let's say, acute care areas within hospital. I'll just give an example. Creating a medical gas management system within a hospital with all the international standards is one of the expertise, to name the few, when it comes to Medikabazaar.
Medikabazaar's equipment lifecycle management vertical, Embark, Medikabazaar Asset Management, Recycle and Care, is an end-to-end real-time online service demand aggregation and monitoring platform to help hospitals manage their biomedical assets. With a presence in Tier 1 and Tier 2 cities, Embark is now expanding to Tier 3 cities to manage the entire life cycle of healthcare asset management through automated systems.
In last 7 to 8 years of our operations, we would have sold thousands of medical equipment throughout the country. So many hospitals buying so many equipment on a yearly basis, replacing such equipment. A lot of challenges comes in when you look at the entire life cycle of the equipment. because equipment once bought has to be carried for next 5 years, 10 years within the life cycle to maintain patient care, maintain revenue flow for the customers and all of that. What we realized that a lot of customers were looking at such kind of a solution through a complete technology driven approach where they could get service on demand. They could get something like what is available to them just by click of a button. So MBARC, what we know as Embark, or what we call as Medikabazaar Asset Recycle and Care as a platform really helps customer get onto the real service on demand and spares availability what they are looking at.
Many medical establishments face a myriad of financial issues such as high operational costs, high capital-intensive business expansion, lengthy finance approval processes, and unavailability of need-based finance. To address these issues, Medikabazaar Freedom offers equipment loans or dedicated credit lines with special interest rates for healthcare professionals. MB Freedom is an easy, fast, flexible and smart financing option for buyers for their medical procurement needs.
Most of hospital buying today is classified in two categories. One is obviously the capex buying and the other part is opex buying, which is your normal day-to-day consumables or pharmaceuticals, everything which is bought in order to maintain the continuity of patient care and supplies within hospital. As a platform, we service both. We service both capex and opex. When we talk of capex, obviously capex comes in multiple dimension and multiple value markers. It can start with anywhere between few thousands and can go up to few crores as well. If you look at cost of a PET CT today, can go upward of 10 crores. If you look at an MRI, can go to 5 crores. If you look at an X-ray system, which can go up to 50 lakhs to a crore. So with this kind of capex solution, there is an imminent need or pressing need for financing solution. That is why we came with an idea of MB Freedom. Freedom is something like it gives you real freedom from the burden of payment and from the burden of looking at acquiring these capex solutions by an upfront cost. That is where Freedom really helps customers. And it is not just for the capital equipment alone. Freedom also helps customers with the OPEX solution. We work with close to 10 plus providers right now, and we are trying to engage more and more providers on the platform to offer solution to the customers.
Well, that's all we have on this second episode of the three-part series Medikabazaar presents Transforming Healthcare. We trust you found the insights shared of value. Thanks for watching.